The Washington Post recently posted this article that talks about how colorectal cancer is now the top cause of cancer death among young people. And what worries me most is some of the early signs of colorectal cancer are being normalized and ignored by many. Now, as a urogynecologist, I see patients in my office every week that come to me because of complaints of pelvic pressure, pelvic organ prolapse symptoms, urinary leakage, but I always ask them about their bowel symptoms, and oftentimes I'll hear things like, "Oh, Dr. Noor, I've always been constipated. I've had difficulty emptying the bowel, but didn't really think much about it. Or I had an episode of rectal bleeding, but it was probably just from being too aggressive when I was cleaning." Here are the key points: persistent constipation, rectal bleeding, new bowel changes. These are warning signs and should never be considered normal. Your bowel, your bladder, your pelvic floor are deeply connected. Sometimes bowel symptoms are not just a diet issue or stress related or because you're not having enough water. They could be early warning signs that you don't want to ignore. Now, this isn't about panic, it's about paying attention to your body so you can start recognizing some symptoms that could indicate need for further evaluation. I'm Dr. Nabila Noor, a board-certified urogynecologist and pelvic reconstructive surgeon, and part of my job is recognizing when your pelvic symptoms are saying a bigger story. If this resonates with you or someone you love, then start by taking actions. Talk to your doctor, make that colonoscopy appointment, don't ignore your new bowel signs, and don't normalize symptoms.